In this video, I will show you a fast way to check atrial fibrillation on ECG, for example before exam. Also, I will share with you a universal algorithm to check any ECG, not only for exams, but for real life also. And describe how Einstein is connected to you and me during the reading of ECG with atrial fibrillation, and why heart rate calculation in AFib takes more time. Also, I will add one extra feature in the end. So we start exactly from the algorithm. If you examine ECG by the algorithms that you see on the screen, you will never make a mistake. So we start from the paper speed and voltage check. Remember, in case of 25 mm per second paper speed, one large box is 0.2 second and one small box 0.04 second. It takes 1 second to check, but helps with correct measurements in whole ECG. The next step is a pacemaker check or examination of the P wave. In our ECG, there are no notable and regular P waves, which means that this is not sinus rhythm. Thus, the first criterion of atrial fibrillation is exactly the absence of notable and regular P waves. So the absence of P waves is a very elementary but crucial ECG criterion of atrial fibrillation, which gives you 50% of success. If you like this video, press like and subscribe buttons. We also have Telegram and TikTok. Don't miss our next ECG video, which will be about the ECG in atrial flutter. The next step is regularity check. For this you need to compare RR intervals to each other. Define the RR intervals as the distances between the peaks of the R wave. Regular rhythm means that RR intervals are equal to each other or the difference between them is less than 10%. Look at our example, even by eye, RR intervals are different. But for more confident measurements, let's do some math.
Can you run the calculations yourself?
About the only thing you and I have in common is a disdain for mathematics.
For this we need to take smallest RR interval, calculate it in seconds. After take the largest RR interval and also calculate it in seconds. Now divide smaller RR by larger RR and multiply by 100. So the RR difference is equal 41%, which is much more than 10%. So our rhythm is irregular. And the second crucial ECG criterion for atrial fibrillation is irregularly irregular rhythm, which means that RR interval changes randomly without any pattern. This is your second 50% of success. As you see, atrial fibrillation has only two simple ECG criteria: absence of the P wave and irregularly irregular rhythm. Now let's calculate the heart rate, but according to an irregular rhythm, we need to do extra work. Specifically, calculating the heart rate for minimal RR interval and maximal. For heart rate calculation, you can use any formula, depending on the paper speed. But in the case where we already have RR intervals in seconds, I will use formula 60 divided by RR interval in seconds. So minimal heart rate is equal to 52 beats per minute, and maximal heart rate is 88 beats per minute. What is interesting is that the heart rate we write down as a range from the smallest to the largest. The next step should be mean QRS axis calculation, but due to limitation of 3-lead ECG, we can't do this. So the next step is measurements of P, PR, QRS, ST and T wave. Both P wave and PR interval do not exist due to the atrial fibrillation, so we start from the QRS complex. QRS complex is equal to 3 small boxes or 120 millisecond, which is an upper limit of the normal range. That requires the 12-lead ECG to exclude left or right bundle branch block. ST segments are on isoline, this is normal. T waves are positive, which is also normal. And the extra feature is the QT interval measurement. We measure QT interval by the most accurate tangent method. For corrected QT interval calculation, let's check the previous RR interval and the heart rate. Now put the values that we have into the app for calculation the corrected QT interval. Remind that in case of atrial fibrillation, we use Framingham formula. Due to RR interval variation, QT interval also changes. So for correct measurements, let's calculate the mean corrected QT interval in few complexes in the same way. The mean corrected QT in this part of atrial fibrillation is equal to 408 milliseconds. If you like the content, press like and subscribe buttons and have a good day.